how we. Okay, Bill, thanks for joining us. Great to see you again.
You as well.
People are joining us, but we'll start. We'll kick it off. Like most good ideas, I think this one started over a pint in Dublin in October, when we had a bit of a gap and we could see each other. I think that was the first time last year we got together, and we were having dinner, and we were just talking about the Preventus story, and we were asking some questions, and then you said, well, we're thinking about doing a case study on it, and I was delighted that you'd say you'd do this for us. For the folks who are joining us right now, if you don't know, Bill Taranto is the founder and president of Merck GHI, Global Health Investments, and has been in the industry for 30 years and investing in healthcare for 20 years. So I'd classify Bill as a pioneer in terms of corporate venture capital, and as a stalwart in terms of having been in the industry for so long and continuing. I think the case study we have today is a great example of kind of patient capital. This didn't happen overnight. Also real in terms of a real unicorn in digital health. And what I mean by that is there's very few that have either IPO'd or been acquired at over the 1 billion mark. There's lots of companies that have high valuations, but there's very few who've kind of gone through and actually exited. So the way we'll run the session is Bill is going to talk about the Preventus story using what's known as the growth value framework, and that's trying to put a bit of rigor, I suppose, in terms of the journey and a bit of structure. And it's a fascinating. Bill took me through it just before Christmas, and it's a very interesting model. So without further ado, I'll just hand over to Bill, and then we'll try and make this as interactive. Bill's going to talk for about 10-15 minutes. Depending on how we go, maybe a bit longer, and then we'll open it up for questions. I've got a bunch of questions, but I'd love to get the questions into the chat so we get things moving. So, Bill, over to you.
Well, thank you. Thank you, everybody, for joining. So we're going to do something a little unusual today. When Martin asked me to tell you the Preventus story and how we built it, it's actually was built off of something that myself and a colleague of mine, Joe Volpe, that's what the TARVO stands for, Taranto and Volpe, something we created almost over 20 years ago while we were at J&J, and over the years we've perfected it. And it's something called the Growth Value Acceleration Model or Framework. And it's a tool we use when we invest in companies. We've done it for most of our portfolio companies. We don't do it for all. And it's something we do either pre-investment to help the company understand us as investors where we believe the company can be taken to from a growth perspective, or it's done post-investment, which we do with the senior staff of the company as well as the other investors, where we bring in experts and take them through this model and framework. What I'm going to show you today is real quickly, I'm going to take you through the 8 steps and what we do, and then how does that translate into the Preventus story and how we built Preventus, from a small equity investment to a $1.5 billion sale to Boston Scientific, and that's the goal today. So the first thing I want to talk about is this growth value acceleration model, and what it is it's a model that allows you to put in waves the growth of the company and how would you build a company typically over a 5-year period. That's usually the time frame that we do. And there's 8 steps associated with it. The first step of this growth model framework that we do with the company, and again, we do this with the senior staff of the company, we do it with the other investors, and we also bring in experts, subject matter experts, to help us understand how to fill out a number of the steps. Because typically these experts are really well known and smart about the industry in which we just invested in. But the whole idea is in the first step is what's called the current state framework. And what we're trying to map out is today just on exactly where the company is. And so the left side of the framework is the market expansion, and the underneath is the product expansion. And what we're trying to understand is how do we map out what we need to defend and expand on our core products? What are new products that we could leverage? And then what are the new capabilities and new products that we need to build? And then from that, is it, in a current market, is it to move into other markets, or is it to create new markets? And the whole idea of this is to map out where you are in each of these sections as a company today. And it's critical not to think forward. It's not where you want to be yet. We're not quite there yet. It's where you are today. And each circle represents a core capability that you have today. And the size of the circle is about how important that competency is that you're good at. And it could be anything from your platform, your people, your technology, your funding. You're mapping everything about your company. And the key thing about this particular step is that you kind of got to be really honest with yourself about where you stand today. Oh, I apologize for that. Because a lot of times you're overstating where you are in the current state, and it doesn't help you as you think about the future state as you build this out. But the key thing about this particular step is you want to make sure that you're really focusing on things you do today. And the other thing that you're really trying to do is not over sort of simplify where you are today. You want to fill this out as detailed as you can about everything you do today and where you're at. So even if you're trying to build a new product and capability, how many years out is that product or capability that you're trying to build? So again, the whole idea is we're trying to just map where you are today. And you'll see as this builds why that is important. The next step that we look at is what we call the strategic options framework. And so now what we're trying to map out here is we're trying to understand the direction we may want to take the company. And so when we get into Preventus, we'll explain where they were at the beginning to where we wanted to take them, and then how it can be positioned against your customers and your core capabilities. So we're looking at your core capabilities. That was the previous slide. Your go-to-market offerings, which is also on the previous slide. What do you have? And then who are your customers? And we're trying to map this out in as much detail as possible. So it's taking that previous slide, and what you're really offering now is who are the customers, right? You're really adding this component, because on the other slide, you should have had your core capabilities and your go-to-market offerings that you have today. So again, we're still sort of in the today market. We're not in yet where we're going in the future, but it's important then how this matches with your customers. Because a lot of times what we think of as a customer isn't always the traditional customer. And it's really important to understand how you identify different customers at different stages of growth within the company. The next step that we map out is something that we call the capabilities framework. And the interesting thing about this particular framework is that the most important pieces of this is at the top, right? But you want to build from the bottom, because we already know what your core is, right? And so what you're trying to do is go from your primary capabilities to your critical enabling capabilities to the strategic capabilities, and then what then ultimately becomes your core. You're trying to build from the bottom up to ultimately have this as your core capabilities. And so what you're trying to think of is, your primary is just what the minimum functionality and technical requirements for you to participate in the market that you're in. Your critical enabling capabilities are things that might be equivalent to your competition of what they do. And these capabilities might often be a barrier to entry because your competition might already have them. The critical strategic capabilities, these are the capabilities where the company then becomes the leader. And these capabilities are the source of competitive advantage. And then finally, all these then become your core in the future, because this is what you're now delivering as your future state. So it's really, again, important to understand, what are the capabilities you have? What are the capabilities you need to be competitive? And then what are the capabilities you need to be a leader within the market? And again, you're mapping all this out, and then you're trying to figure out in a time frame, how do those become your core capabilities? The fourth step is pretty simple. This is just your market landscape and trends framework. You're trying to understand, what is the market size? What are all the drivers within the market? And what are all the key trends within that market? So this one's pretty self-explanatory of what you're trying to understand about where you compete. But what's important about this particular place is you also need to look at future markets and try to map those out as well. Because what tends to happen is when we do this exercise, everybody thinks about where they're working today, But if you're trying to map out a future state that's 4 years out, you might actually be in a completely different market with different trends, different competitors, and different market drivers, and maybe a different market size. So it's important to think of both today's market and the future market. This is also part of step 4. This is the competitive landscape and your customer segmentation. So again, who are all your competitors? And again, it's not just your competitors today, it's who your competitors are in the future based on the previous step of how you're going to move up your capabilities as you grow your company. And then who are all your different types of customers? And your customers today may be different than your customers tomorrow. So again, you're starting to map as you think about how you move into the future, how does this change for you? So again, this is probably one of the easier steps to fill out, but again, it's a build from where you were off your core capabilities. The next step is something we call use case mapping framework. So this is actually, believe it or not, a little bit of what we do in Preventus. This is kind of the Preventus use case mapping. And so what you're trying to do is understand what the market need. And a use case is just a problem you're trying to solve or something you need to do within the market. And is it low, moderate, or large from a market need? And then is the time to value, is it short-term, medium-term, or long-term? And so it can, if you think in terms of a monitoring company, if you just kind of look at this as an illustrative example, simple things like, sourcing procurement or targeted promotions is pretty easy to do. But when you get out to personalized medicine or value-based care as it relates to monitoring, those things are very difficult to do. And that's a long-term solution. And it's a huge impact on the industry. And what you do within this step is you take all your use cases and you break them out to where they sit within life sciences or other areas. And then the numbers also represent importance. What's most important to you to get to as you map out these use cases. And again, use cases is a term, typically used in the pharma industry, but it just means things you're trying to solve for. Think of that as a use case. And so what you're trying to map out now is all the things that you'd like to try to solve for to build your market. And then where does it sit on the need versus value? And again, this becomes the key piece now as you start to begin to map out what the future looks like. And I'm going through this a little quickly because I really want to go through the Preventus model to show you how we kind of use this. The next step that we do is called future company framework. So this is now where you're taking everything that you've thought about of where you need to be, and you're starting to map out what does the future look like? Who are your customers? What are the capabilities you need? And what is the differentiation or the differentiators you need in order to be successful within that market? And you're trying to be as broad as possible. And this is a lot of blue skying sometimes. You might say, we want to be X, but it's probably not something you're really going to attain, but it's okay to have it as aspirational or something that you're trying to achieve to. So you want to map out in this step at everything you think that you can jump to. So it's your current state that you did on that very first slide, and then through all the next 5 steps, what do you think your future state is going to look like? And you compare and contrast those two. The 7th step is now actually mapping, which looks very similar to the very first step, is your future state. And you're doing the same exercise, is you're mapping out everything, so you take that first slide, which is your current state, and now you're putting on top of this, what's the future state? And again, it works the same way. The size of the bubbles are important. And then the idea is you could click on one of these bubbles, and that would take you to a whole nother framework about what that competency is that you're trying to build for. So an example, like in Preventus, where we wanted to upgrade our devices. Well, that wasn't going to happen overnight. That was maybe out here in wave 4, where we would have a fully automated 4-in-1 device. But how are we going to build to that? And if we would click on that particular bubble, it would tell us how we were going to do it. Because you also map out all the things and all the steps you need in order to build out that competency. So it becomes very detailed. And the whole idea of this framework that we do for the investors and for the companies, it just becomes a living document that you update continually as time goes on, because the market changes, things change, and then you might have to adjust how you're thinking about the company. And then from the future state, the last step is, well, how are you actually going to then put the roadmap together? What are you going to do in wave 1? What are you going to do in wave 2? And what are you going to do in wave 3? And if there's a wave 4 or wave 5, you're now mapping out the things you actually can do, because not everything you can act on. Sometimes it takes capital, sometimes it doesn't. Some is going to be inorganic, some is going to be organic. Some of it's going to be partnerships, all the things that you need to do. What's the roadmap that you're going to do in each wave, which is time. Waves are just time to build this out. And then the whole idea is you then come to a future state that you're building towards that hopefully become your today's core capabilities as time moves on. Now, I went through that pretty quickly, and I'll pause just for a second. If anybody has any questions on the sort of the model that we use, again, this talk normally takes about 2 or 3 hours. I've done it for Columbia, but we're doing this rather quickly because we only have an hour. But I didn't know if there was any key questions on just sort of how we map this out for a company.
It'll just get the ball rolling a little bit before we get into Preventus. So just talk about the mechanics of it. So, how much work, how do you get people together? Kind of just talk about some of that.
Yeah, so the way it works is it's usually a 3-day exercise. And what we do is as I said, obviously we work with the CEO and the board because they're typically invited. And then the CEO recommends, what key staff members that they would like to attend. And then from that, we work with the board and the senior management to identify who are the key external stakeholders that we need to invite as subject matter experts. And typically what we have found is it usually takes about 3 full days to pull this off. Now, you're not even done after the 3 days. That's just actually filling out most of the framework. And then what you're doing after that is you're working with your board, you're working with your management team to really finalize how this actually is going to play out over time and how you want to move this forward. And you're doing this again, also with your investors, because they're there to help you try to build this. And then what will happen is usually after about a month, you're not, after the first 3 days, you're not spending 8 hours a day. You're maybe spending an hour to an hour and a half a day revisiting it until you finally get a final plan that you then use as your sort of roadmap. And then what we continue to do is, what we try to do is once every 6 months, review it just to make sure, has anything changed in the marketplace? And then, or if something happens that you didn't map just yet, something unpredictable happened. And I'll explain one of the ones that happened in Preventus, where you can use this framework to map out something that you didn't even see coming, but how are you going to act? And it could be something like a natural disaster, which happened to Preventus. We had a massive flood at one of our facilities. We had a CMS violation, which stopped our reimbursement. Well, how are we going to, respond to that? Well, you actually use this framework to map it out because it's your current state. Well, this is just what happened. What's our future state and how are we getting there? How are we going to resolve this issue? It can be used to hire, your management team and your C-suite. You map out what's most important. Well, maybe we need a CFO first. Maybe we need next in line as a head of marketing. So you use this sort of framework for all sorts of different things as you build out your company. And it's what I found it especially good at is when sort of the unexpected happened, because you now have a framework to almost like in an emergency situation, map something new out. A new competitor came in with a better device. Well, what are we going to do? So this helps you get through that sort of framework, but it takes a full, we normally do a full 3-day sort of offsite start, to get this thing launched with our companies.
Okay, good. And the timeline is 5 years, 10 years?
We try to do 5 because, as a growth investor, we usually think that it takes about 5 years from the initial investment to get the company to where we want it to be. So it's usually, I would say it's 3 to 5 year, with 5 year being the farthest out, 3 year being the point you want to get to, because between year 3 and 5 is where you're trying to sell the company and move on.
Okay.
Because remember, we come in as growth investors, typically at Series C, so the company's been around already, a number of years. And so we're trying to accelerate that growth to an exit. And that's the purpose of this.
Okay, cool. There's some questions coming in, Bill, so I might just ask them now and then we can get into the detail, if that's okay.
Yeah.
Yeah. How you select people who will be integrated in your core team? Talk about capabilities, but what about the mindset? Which kind of mindset do you look for? So I guess this is as you're thinking about the investment and thinking about the capabilities team, but also the mindset. Does that factor into this, or how do you think about that?
It does, because you want buy-in, right? I mean, one of the things that before we even do an investment, one of the things we bring as an investor is this growth strategy framework. And so one of the things we talk to the management team, the board of directors and the other investors is this is one of the things that we like to do. And is there alignment around it, right? We almost tell them in advance what our vision of the company is, because we've done this a little bit in advance as a team, because it's one of the reasons that would prompt us to want to invest in a company. So we do some pre-work on our own before we even involve the company. And so you're looking for alignment and buy-in from the team to do this. And then I think what helps a lot is, one of the most important groups, believe it or not, are the external subject matter experts that you bring in, because they come in neutral. They're almost like switching over. They're going to give you an honest feedback of what the market's doing, what they see, and then where you stand within that market. Because look, a lot of times the companies always think they can do more than they can. They think they're better than they are. And it's not an insult. It's just saying, be realistic and then build something. And if we do that together and we're all aligned, we'll get there much faster. But if there's not alignment, like we've had times where we've brought this to a company and they didn't want to do it. It didn't necessarily prevent us from investing. We just couldn't get full alignment on what we wanted to do with the company. But I would say the majority of the time, almost every company we've invested in wants this done at some point.
Okay, great.
It's a value add as an investor.
Yeah, it's great. Let's get into Preventus then.
Okay. Fantastic. So if you don't know Preventus, Preventice Solutions is a cardiac remote monitoring company. It was founded in 2007. And it was one of the first investments we ever made as Merck GHI. And it was an unusual investment for us. It was a $2 million investment. And we don't normally invest in companies that are pre-FDA approval or still need their approvals, whatever they are. They didn't even have their device. They had submitted for approval to the FDA their device, but it hadn't been approved yet. But the reason that we wanted to invest in this is that we had a vision that we called Project Galaxy. And what Galaxy was a whole metabolic monitoring universe. And because cardiac was the most advanced area of monitoring 10 years ago, 12 years ago, in 2011, 2010, we thought that was the best place to start. And so we found Preventus's device. At the time, you gotta remember, it was probably one of the most sophisticated devices. It was a little Band-Aid that you'd put on your chest that could measure, your EKG. It was for, it was probably the most advanced device at the time for cardiac monitoring. And most of you know that, or may not know, that we were also an investor in like Livongo. And believe it or not, and I'm only jumping ahead for a second because of what Project Galaxy was supposed to be, is we wanted to eventually merge Preventus and Livongo and create one of the largest metabolic monitoring companies in the world. Just Livongo moved a little too fast and IPO'd before we could actually do that merger. But that was what Project Galaxy was bring in other conditions like diabetes, but all in the metabolic space, measuring blood pressure, weight management, all the different things that affect metabolic that we could monitor. We thought we could create a single company that could do all that. And that was what was behind the original investment, if you could believe it. So over the course of the next decade, we continue to invest capital in Preventus while also supporting Preventus through strategic planning activities to help the company expand its offerings and finally grew its revenue to over $150 million. And of course, as I said, in 2021, we sold Preventice Solutions to Boston Scientific for $1.2 billion. And there's also an earnout associated with it on top of that. So what I'm going to take you through a little bit now is how we built this. Because if what happened with Preventus is when we invested in it, it was only a device company, but they didn't actually know how to monitor anything. So we had what you would call the front end of the solution. We had the device, we had the algorithms, and we had the connection to Mayo and their cardiologists. What we didn't have was a back end. Like who's actually monitoring the loops that come in and the signals? Where are the electrophysiologists? How are we getting devices out to the customer? How are we triaging, patients as they do the reads back to Mayo, in that closed loop environment setting? What if a patient needs customer support? Where is that coming from? So we didn't have any of the back end. And so one of the things that we did at the beginning in 2000, we did the investment in 11 and we did a little mapping. And then in And within that mapping, we realized that we were missing that whole back end. So the first time we did the growth strategy framework was right after the investment in 2011. And we mapped out in the first wave that we wanted to complete within a 3-year period was an acquisition of the back end. And we identified 4 or 5 different companies that could do that. And we found this company called eCardio that was out of Houston, Texas. And eCardio was basic Holter monitoring, the old device that you'd hook around your waist that you would go to sleep with, and it would measure. But they had the whole back end. They had almost 400 employees, they had 125 electrophysiologists on staff, over 100 nurses. They could clean and ship devices. So just think of it as the infrastructure piece. They had a call center, all the things we were missing, because really in the end, all we had was a device. And so what we then decided to do was bring those two together. And so what we did was we acquired Preventus and then acquired eCardio. And again, that was done through this growth strategy framework, was to identify the main thing that we were missing and how we were going to get there, and identify the piece that we were going to get to, and then build this platform out. And that was the initial vision for a combined entity, which then became Preventice Solutions. But then we thought, as time goes on, we needed to map out a growth strategy framework again of how does Preventus fit with a broader cardiac monitoring ecosystem? And how do we get a full closed loop ambulatory monitoring platform working? And how do we build to that? And what other acquisitions did we need to do? We didn't have a care coordination component. We needed additional algorithms. There was a lot of other things that we needed to add, and you can see what we mapped out on this right side were all the different things that we felt we had to put in. How do you initiate the service? How do you do the monitoring, data collection, clinical action, then the provider applications, and then notification, and then it keeps going in a circle, and how do you get that patient treated when they do have a cardiac event? And so the whole idea that we mapped out was to build this particular, this competency out that you see on the right. And we mapped that through the growth strategy framework. Now, remember, we did this in phases. The first framework that we did in 2011 was how do we acquire the back end? The second framework we did when we revisited the framework was how do we actually now build the company? Because now that we have the back end, the front end, we actually have to make it work in a full closed loop system. And that's what we mapped out and then began to build. And so we did the same thing that you saw on the steps. One of the things that we did in the framework process was start identifying the core capabilities that we had and then understanding what the growth opportunities were. So we mapped out, much like we showed, is, what were the new core capabilities? So we combined eCardio and Preventus, and now we're mapping out what do they do today? What are their core capabilities? And what do we need to do to go from the bottom to the top to build out this particular company? And then the idea is really, how does Preventus and eCardio bring together a next generation device with a fully enabled ITF services capability? Because that's what we were bringing together. And so what we had to understand is, what did Preventus have? And what did eCardio have? And then what are we missing? And then how do we build that going forward? Because, just because we did an acquisition didn't mean we had everything. And just because we had Preventus before didn't mean they had everything. We still had a lot of gaps. And we had to build in those gaps in a time frame in order to get those executed. So again, you can see this framework starts to work when you start to add the different pieces that you're missing and how you're going to think about building it. So what we ended up then doing is, now I'm skipping a couple of the steps just for time and explaining what we did. But the idea was that once we understood the core capabilities of Preventus and then defining the growth opportunities within the core products, we then looked at new products and then leveraging the core capabilities and new capabilities. So you can see on what we did on this side, we wanted to defend and expand our core products. So we wanted to concentrate on our core products in the combined company. We wanted to leverage eCardio's sales force because they had one. We didn't have one at Preventus. We wanted to understand the mix of offerings that we're able to take our customers, and we want to review cost synergies. We wanted to expand into other indications. We wanted to use core device monitoring, and then we wanted to develop and acquire additional devices and capabilities. But what we realized when we mapped all this out is we actually, as GHI, we're not a cardio company, and we didn't have any expertise. So one of the things that we identified is we have to actually bring in a partner. And that's where Boston Science came. We actually looked at all the cardiac companies that were out there, and we realized that Boston Sci at the time made the best partner available to us to help us grow this, because they had a knowledge of the market. We knew they wanted to eventually move into this monitoring capability. And the idea was that we just needed more capital and a larger or a more sophisticated partner than GHI to help build out this dream. And so we brought in Boston Scientific, and we sold 25% of the company to Boston Scientific. And what was interesting is, by doing that sale, we paid back Merck the majority of the capital used to acquire both companies. So already, we were sort of playing with other people's money, so to speak, but owned still almost, 60% of the company at the time. And we're able to build it, with this additional capital. But that's what this allowed us to do, is when you start to map this out, you really then begin to understand what you're missing, what you need to do to build it. And that was why we brought in Boston Scientific at the time, was to help us build out this particular company. So what we did was we mapped out what all the things we wanted to do and what we wanted to do and what time frame with Boston Scientific. So the whole idea was wave zero, right? Organization integration, right? We merged two companies, platform integration and product integration. So that's where the merger came in of the two companies. The next step was we wanted to move into new areas and new products. We wanted to move into readmission reduction, lower the length of stay, cardiac rehab, clinical care extension, and then EMS and EICU were the new areas that we wanted to move into, which was our wave one. Wave two, we wanted to move into new TAs. We wanted a profession-based health, patient engagement, risk stratification, patient outreach, and then further out, which was other monitoring. This is where, things like Livongo came in. How do we actually move into other areas of metabolic or other areas of monitoring that we could combine with Preventus and eCardio? So again, we started right here in wave zero, and the whole idea is we mapped out each wave and how we were going to move forward. So what did that look like? So we thought in wave one, the actions that we wanted to take, what were the different offerings, the therapeutic areas that we wanted to go into, and then the potential execution partners that we needed to do that. And then we did it in, each wave, and we put timeframes on it. That wave one was going to be 2014 and 15. Wave two, we thought we'd do from 15 to 17, and wave three, 17 on. And what we ended up doing in, wave one was we actually ended up acquiring more companies. We ended up acquiring a company that did cardiac care management. So we were able to monitor. So once the patient got on the device, how do we care for that patient once they're on the device, and then once they're off the device? If it was a 7 or 14-day monitoring, we still wanted to care for that patient and make sure that they were okay. So we put a care coordination company in play. And then we also bought additional algorithms to enhance the device and make sure we were monitoring different types of cardiac abnormalities within the device. So it wasn't just basic Holter monitoring. We could do other types of cardiac monitoring. And that was the main thing that we tried to do within wave one, and then adding multiple partners to do that with us. And then moving out to wave two and wave three is, where we were thinking about trying to get into other areas of like diabetes, COPD, and other therapeutic areas, but also moving into risk stratification, patient engagement, and health alerts. What I would say we did is we did a lot of the offerings. We just didn't get to the other therapeutic areas. That was where, we were trying to think about, and that's about the time we did the investment in Livongo, was around 2017. Was thinking about, well, if we do that investment, what if we could merge those two companies together? And that would happen in wave three, perhaps. But again, Glenn Tolman IPO'd Livongo a little faster than we were ready to do that. And then again, moving into other areas in wave three. So I'm just going to, I don't know how much time we have, Martin. I think because I want to get questions. So let me go a few more minutes, but this is what we did in each wave, just so you get more detail. In wave one, what we ended up doing in the chronic transition is we created a next generation device. We enhanced the device that we had. We moved into, the reduced length of stay. We added cardiac related activities. We added acute capabilities and additional engagement services. That's where that chronic care management company came in. But we really upgraded the device that we had and did that over sort of a 2-year period where we expanded the company. And then in wave two, we moved more into the enablement section. And again, this is all mapped out in that growth strategy framework. So this is where the big detail comes in. And then you try to build towards these type of things. And again, we did this in wave two, as I mentioned. And then wave three, we tried to move into non-acute tracking. We didn't quite get here at all, but none of these on the left side we ever got to, but it was the idea we were trying to get to. So what I would tell you is we got all wave one done. We got to wave two, we got to the engagement outreach, we got to some comorbidities, we got to some therapy compliance and some other small engagement capabilities, but we weren't quite able to get as far as we wanted because it takes a lot of capital, that the company needed. Yeah. But the company was growing. Remember, we were growing revenues every year. The company was becoming very successful. And the last thing I'll talk to you about is why this framework is really important, because you can use it for things that we call above the water and below the water. And below the water are the things that happen that you never expect to happen, that you need to act on. And above the water are all the positive things that happen. And why this framework is really important is because you don't always have to use, everybody thinks the framework's for, mapping out acquisitions and how we're going to grow the company, but it's also really good when things happen. So one of the things that happened to Preventus is we had what was called a CMS flag and partial shutdown. And all that happened was in one of our facilities out in California, we had the wrong paperwork of who was working within the facility. It's as simple as that, but we had no infrastructure around how we were monitoring all of our internal policies and procedures. And what happened was for 3 months, we got no reimbursement for any of our activity. So imagine a company going for 3 months without any income. We have to pay employees. We have to keep the company going. Now we could always, after the 3 months and the suspension gets lifted, we can get the money back, but you have to survive for 3 months. So we use the growth strategy framework to do two things. We mapped out how we were going to survive without no income, but how we were going to fix the problems that we had. And we realized that we had to automate all of our policy and procedures from paper to electronic. So it couldn't happen again. And that's exactly what we did. We invested capital in the company to create an electronic policy and procedure sort of infrastructure that would never allow that issue to happen again, that everything was always monitored electronically, where we weren't relying on somebody looking at a piece of paper and saying, oh, you have the right paperwork filled out. And we also mapped out, how we were going to survive for 3 months without any capital coming into the company. And so this is where the growth strategy framework helps you. And of course, this is a short term, right? We had to map out 6 months of life, right? Because it wasn't going to happen overnight that we fixed the problem. But we, first step was, survive the 3 months. And the second step was fix the problem. And we mapped out what we had to do that. And so you can use it for a lot of different things other than just growing the company. I like it because it does help in areas where you have, issues that come up. One of the other big issues that happened to us is I forget the year, I think it was around 2018, where the floods hit Houston, and we got flooded, our whole facility. And so what it ended up doing was, one of the things we realized is we didn't have a resiliency plan in place for natural disasters that could happen. And so one of the things we mapped out with the growth strategy framework is all the different types of disasters that could happen, and then what was our resiliency plan around each of those disasters. And now we have that in place, and we were able to solve that particular problem. So the whole idea is that you can use it for a lot of the positive things that happen, but it also works really well for the negative things that happen within a company. And again, you use it all the time to keep your company going.
Yeah.
And then finally, to wrap it up, so we can get to questions is, so we did the growth strategy framework in 3 big phases. The first was from 2007 to 2014. We make an investment in the company, and how are we going to get to that first stage of building the back end of the company? So that was the first mapping that we did. And then in 2014, we bought eCardio and then built the bigger company that was today. Then we had to do the second growth strategy framework, was how do we build eCardio Preventus into a new company to get to exit? And then we did the final sort of growth strategy framework in 2019, where we said, how are we going to exit this company? We're now at 160 million in revenue. Are we going to IPO? Are we going to sell? Or are we going to continue to build the company? And we mapped out that the best solution for us in the growth strategy framework was to actually sell the company to Boston Scientific, who happened to be one of the insider investors at the time. But we came really close to IPOing the company. In fact, what happened was, we submitted our S1 filing, and then Boston Scientific calls us in December and said, give us 30 days. We can buy this company in 30 days, don't IPO. And they literally closed it in exactly 30 days because on January 19th, we were set to file for an IPO in February 5th.
Great.
And they came and did all the work, and we worked over Christmas and actually closed the deal and never got to IPO. But we did it in 3 ways, and it shows you how you can build a company using this growth strategy framework, and how we built Preventus from a $2 million investment and $8 million in revenue to a $1.5 billion company and $160 million in revenue, and it took time. It didn't happen overnight. So
yeah, it's brilliant, Bill. So we're going to the end, and then we'll work to the start. So this final jump, going from 475 mil to over $1 billion. Yeah, just talk a little bit about that and the IPO process and the kind of dynamics around the deal.
Yeah, so where it really changed is obviously when we did the acquisition and Boston Sci came in, that was the first jump in value, real jump. Because when you merge 2 companies, it's a bit of an artificial jump in valuation, right? Because it was the purchase price of each company set the valuation. We bought eCardio for 145, I think, and Preventus was valued at 70, and then so where the real value began to come in was twofold. One was that we were able to create the top device called the Body Guardian Mini. We went from that big Band-Aid sort of thing to a little mini device that was a 4-in-1 that could do all sorts of different types of monitoring. And then from that, adding sort of a service platform that allowed us to be a full service company to all those patients. And what ended up happening is all the cardiologists in the market, we were the differentiating company, because people could come up with sort of an equivalent Body Guardian Mini, but people didn't have a fully integrated solution that allowed you to fully not only do the loops, but actually care for the patient as well in our platform. And what we then began to see is once 2018 occurred, the revenue just jumped like crazy. And from that, we decided in 2019, we were going to do an IPO, and we got CRG financing to jump to the IPO. That was our mezzanine financing to clean up anything else we had to clean up. And then what ended up happening is we brought in Vivo Capital in 2020 to go ahead and be the final. We brought them in because they could help us with the IPO and the distribution of the shares. That's kind of their expertise. And they came in, and at that point we got to almost 170 million in revenue. And that just sparked the valuation to just go crazy from 475 to over $1 billion, because that was what the IPO was going to be. The IPO was targeted at 2 billion, 1.8 to 2 billion. And because, that's the natural jump, because, 10 times revenue was pretty easy to justify. And the 475 was just a pre-setting to get the funding, but we knew it was worth over $1 billion at the time. So that's kind of how we jumped. But it was based on the device, the platform being built, and then the revenue just going through the roof, and the cardiologists fully adopting this as the #1 platform.
Yeah, great. And so the plan was you were going to IPO, but I guess in the back of your minds you had a strong indication that Boston Scientific or some other might come in and do a deal.
Well, that was the whole idea. We thought we didn't mind IPOing, but we had in the back of our mind that either Philips, Boston Sci, Medtronic were going to intervene. Now, Boston Sci had the best ability to, because their cost of capital is good, right? They were already owned 25% of the company, so they probably had the best ability to give a higher bid, right, and move quickly, because they were with the company since 2015. And that's exactly what happened. But we were actually, it came so late, it was a little surprising because we filed the S1 in December, and then literally the day after we filed the S1, Boston Sci called and said, "Can you give us a 30-day exclusivity? We want the company, we'll close this deal." And we said, "You have 30 days. If not, we file on January 19th and we're IPOing." And we came real quickly to price. It was just, could they close it? So it worked out wonderfully. They were a wonderful partner. And now Preventus this year, I heard, is going to do 220 million in revenue. It's doing unbelievably well under the Preventus, or the Boston Sci umbrella, which it needed. It needed to be under a bigger company. To grow. We did everything we could, and it's in the right home right now. And my understanding is Boston is doing a wonderful job with them.
Well, that's great as well to know that it wasn't just, it's not just about the deal, it's about the ongoing value creation as well. So, and so you didn't have to get into an auction, you didn't have to get Phillips at the table. They came in and said, okay, 30 days. And
the interesting thing about the growth strategy framework is we shared Project Galaxy, with Boston. This is what we thought we could do with the company if we decided not to IPO it, or if we IPO'd it, how we were going to grow the company.
Yeah.
Right. And there still was a thought we could, prior to then Livongo selling to Teladoc, could we still merge with Livongo at the time was something, and then would Preventus eventually end up with Teladoc maybe at the time before we sold it? That was the thinking.
A couple of questions coming in. One from Jeremy Son, and he's saying, how do you incorporate Horizon 1, 2, and 3 strategic thinking? How do you? I suppose what he's really asking is the balance between the short-term stuff that you need to do, planning all that out, without ignoring the really transformational thinking.
Well, you have to be realistic. Do you have the capital to do what you need to do? Because ultimately, in the end, most of this takes capital, right, Jeremy? I would say you really want to focus on the short-term wins that help you differentiate and establish yourself, and then figure out a way to the longer aspirational wins and how much time. Because look, it took us from 2014, almost 5 years to 2019 to get that aspirational device out, which was this mini Guardian. It took 5 years, but we did a lot of things in the first 3 years to build out this company that were easier to do and smarter to do, instead of jumping right to try to get this device out. And it wasn't the right time. So I think you have to be realistic with the other investors. You have to be realistic with the management team about what you can and can't do. And one of the questions we get too is, why didn't Merck buy this? And what happened to Merck was in 2007, we were a cardio company. We were more of a primary care company.
Yeah.
But what ended up happening in 2016, Merck switched to a full biopharm company in 2016. And so we're an oncology company today, and we moved out of a lot of the areas that we're in. Like, we're still a little bit in diabetes, but we moved out of cardiac, we moved out of all the areas of why we were building this. And so we were not the right acquirer anymore. Right. So that's why it wasn't strategic to Merck, but that's why we brought in Boston Sci too, because we knew ultimately a cardiac company would have found this interesting. So hope that answered the question, Jeremy, but you just got to be realistic in how you map these things out and what you truly can do. But it always comes down to capital in the end. Yeah.
Okay, great. Got another one from Steve at PHS, and I guess it goes to the start. So when you were doing your landscape, you were looking at like who the potential companies are you were going to invest in. How do you look at that landscape? How did they come onto your radar, and talk about the early days?
Right. So it starts with a use case. So the use case we were trying to solve in 2007 is how do we prevent AFib, and how do we solve the AFib problem? And so what we did was we landscaped all the devices and all the monitoring companies, if there were even any monitoring companies at the time, because remember in sort of 2010, monitoring is sort of where, monitoring is very ubiquitous today, but it was sort of where you might think AI is today. It was in its infancy.
Yeah.
And so we were really looking, who best had the device to solve that use case. And we found Preventus had this device, it was called the Body Guardian, which was moving away from the big Holter monitor to this Band-Aid approach that would sit on the chest in FDA approval process. And it beat every other device we could find. We just found, and Mayo was behind it, and that helped a lot because it was a spin out of Mayo. And we got friendly with the cardiologists at Mayo, and they were going to eventually be the back end to it. And so we saw as a solution, this was the best one out there, but it started with a use case. Most of our investments come with a use case we're trying to solve, and who best fits that use case. And you've heard me talk before about an anchor tenant.
Yeah.
We do ecosystem investing, and we try to find an anchor tenant first. And Preventus was part of the anchor tenant, with eCardio coming in later to solve the big anchor tenant piece. And then the gaps were, well, we needed more algorithms, so we got an algorithm company. We didn't have a care coordination company, so we got a care coordination company. You fill in the gaps, but the idea was the best anchor tenant at the time in 2011 for us was Preventus.
Mm-hmm.
And that's how we found it. But it was based on a use case we were trying to solve. How do we solve the AFib issue in the US?
Okay. And then as you go through and you start acquiring companies, I think what Steve's question is getting to is like, how do you find these companies and how do you do your due diligence and how
Yeah,
do you...
so we research it. I mean, we hire, sometimes it's hiring external consultants to help us landscape a market, but we do an exhaustive review of a specific market. When we wanted to find the care coordination company, I think we used Accenture at the time to help us identify globally every care coordination company working in cardiovascular disease at that time. And then from that, we'll identify 3 or 4 companies that we think are best in class. And because you may not get your first choice sometimes, right? But then we go after the one that we think is best in class to see if we can get an investment done. We just cold call them and call them up and explain what we're trying to do. We're very transparent about what we're trying to do. And in this particular case, we made an acquisition instead of an investment, and they were open to the acquisition. But if it was an investment, we would have done the same process and then identified them and saying, we're interested in investing in you. Why? We have this company over here, Preventus, that does this, and we think you're a natural partner to this particular company.
Okay,
and
great.
That's how we do it.
Great. I have another question here from Bram, and he's asking about the this is a success story, right? So this is an amazing story in terms of becoming a unicorn, the exit, but there's also lots of companies that don't make it. And I guess he's asking about what type of, I suppose asked in 2 ways. One is what were the things that helped Preventus be successful versus maybe some of the other companies you've seen, and if there's any kind of failure factors is how he puts it.
I think a lot of the success came with aligned investors, an aligned management team, an aligned board, and because you're all building to the same thing. And if you're building to the same thing, then you're all putting capital in and raising capital to build the same type of idea, and you're all bought into it. A lot of times where this doesn't work is when you don't have alignment between investors, or you realize, and sometimes it does happen that post-investment, you really can't build a company the way you thought you could build it. Something's happened in the environment that's changed or in the market, and what you thought you were going to be able to do through the growth strategy framework, you're really not going to be able to do. And then what you're trying to then do is survive. And how do you get the company exited, maybe to not what you thought it was going to be, but to where you think it could be. We've done in our group about 65 investments. We've had 41 exits. And of those 41 companies, we've done this growth strategy framework for probably 70% of the companies. So it works for us. And we've had 4 failures, complete failures. So our strike rate's pretty good, but we've had 4 like total bombs. It's pretty small. But it happens, right? It's venture capital.
Yeah, it's venture capital. So yeah, that's the...
and all those 4, 3 of them we did not do this growth strategy. One of them we did, but there were reasons why it didn't work that had nothing to do with the growth strategy framework. There were just other extenuating circumstances that prevented the company from succeeding, but it didn't work. But for us, this exercise works really well for us and helps us build companies. They don't all exit for 1 billion, but we've had pretty successful exits using this particular growth framework.
Okay, perfect. 2 more questions, Bill, if that's okay. I think we're almost at time, but Ahuti is asking about how far, if you were to go back to 2011 and the original vision, how far did that actually move as you kind of discovered the markets and you had the below the water events? And how much kind of course correction was there from the original vision, or did the vision stay the same, just the route to get there?
Yeah, so that's a great question. So we mapped out in 2011 the acquisition of a partner and then adding a partner, and that stayed the same, believe it or not. So we got through 2015 following the roadmap exactly. Where the roadmap kind of we never expected to exit in 20. We thought we could exit in about 2018, but a couple things happened. One was a couple of the underwater things that extended time, right? We lost probably 7 months, 8 months to a year because of the CMS issue. Not because we didn't resolve it quick enough, but it took a lot of time to rebound from that. So we lost either, and then it took us much longer than we ever thought to get the first body guardian mini out. It just technically was hard to do because it went, it's a teeny little device. I mean, it's so small, and we thought we'd have that out by 17, and that didn't even come out till 18. And we then actually changed it to even a smaller device with a platform play in 19. And so, I would say from 19 on, we followed it exactly, but from 16 to 19, it got revised a bunch of times and kept extending our runway. So 11 to 15, it went exactly as planned, and 19 to 21, it went exactly as planned. But 16 to 19, it didn't. But we kept updating it to keep moving, right?
Yeah.
It just, things happened that we didn't know were going to happen. And we had delays and things, and it just, but that's why it works well, is you continue to map out and grow and change, and keep the company going.
Yeah, perfect. Well, last question then. In my experience with you over the last 8 years has always been, I haven't seen you being phased about anything, but I can imagine when you were some of that underwater, below the water stuff was happening, you were sort of having to steady the ship and convince people that, look, no revenue coming in, CMS problems. How, just talk as much as you can, probably can't share everything, but a little bit about like the kind of managing that process.
Well, it's scary, right? Because what happened is there are only two investors. It's us and Boston Sci, right? And so that's a large weight to carry with only two investors. So we had a choice in when that CMS issue happened was, do we go to raise money or do we put the money in ourselves? And what happened was Merck and Boston Sci put money in, but Merck put the majority of the capital in. But Boston Sci did participate, but we put in 90% of the capital because we believe, well, two things. We own 60% of the company. And we believe this was still a super valuable company if we could just get over that hurdle. And I would say at the time, Boston Sci didn't know if we'd survive. So they still put capital in, but I understand their position at the time. Until we could get this BodyGuardian Plus out and show that we could grow the revenue the way we want to grow it, they were suspect of the company still. So it was really scary because we had to make the decision. And I remember Joel Volpe and I had to go in front of our CFO with our head between our tails because we thought we'd be exiting in 18, where we go and say, we need to put $20 million into this company. Right.
Yeah.
And, and the question is, are you going to be able to get that 20 back plus, the remaining money you had in? And remember, we had paid back almost 100 million of the 140 we had spent previously. But when we sold the company, we only had about 60 million in the company, and we owned at that time, 50% of the company. So you can do the math. But it was really scary and hard. And it doesn't go away overnight. So you're on the phone almost every day. I was chairman of the board of Preventus. I'm on the phone almost every day, 2-3 hours a day, trying to resolve these issues for a 8-month period. It was extremely difficult and hard, but we believed in the company, and we knew what we had there. We just had to get over this hurdle, the underwater hurdle. And the funniest thing is, as soon as we resolved that CMS issue, the flood happened.
Yeah, right.
And we couldn't get anybody in the office because it was flooded. And so how you monitoring when you can't flood?
Yeah.
Right. So we opened up we quickly opened up a secondary office actually in North Dakota. And, we're able to, and we had an office in California, so we just shifted everything. But, these things happen and you got to just be resilient. But if your base plan is in place and you have a good system in place to combat these things that happen, you can get through them. But again, it comes down to capital, right? And Merck was willing to put the capital in to keep the company moving during that 2-year period. And it worked, we solved the issue. And it was funny, once we came out of the CMS issue, revenue just shot up because we had the platform done.
Yeah.
We went from like 110 to 160 in 1 year. Then it just started snowballing. Yeah. And we believe that. And then that's when, of course, Boston Sci came back and said, nope, now we fixed it. They thanked us. They knew we did what we did.
Yeah, that's a great way, a great way of finishing. But
a little bit but a little bit in negotiations, we told Bob, but now you got to pay for it.
Yeah, right. That's right. So a great end, a great transaction, a great story, and also kind of emphasizes that having that plan there kind of gives the confidence when the road gets rocky, and with any company, there's always ups and downs, to stick with it and have the belief. So, right. Unfortunately, we're up on time. We got through some of the questions, not all of them, but this has been a great way to spend an hour, and just want to again thank you for your time. And
yeah, the only thing the thing I'll leave everybody with is whether you're an investor or an entrepreneur, you don't have to use this particular growth strategy framework model. You know, we're going to publish it and make it available to everybody. But the idea is you, whether it's your company or your investor's company, whatever exercise you do, it's very important to map out beyond 6 months and a year. You know, you really got to understand and be honest about what your company has and what you want it to be. And if you can just do that exercise alone, you know, you're on your way then. And that's one of the things I just recommend out of this is do your own growth strategy framework. If you're not going to use this particular one, it just helps you grow a company.
Yeah, perfect. Thank you, Bill, and hopefully we'll see you soon.
Take care, everybody. Thank you.